Hi, I'm Jason. I'm the founder of My Rehab Connection, and I'm also a clinician here at Great Chiropractic Spine and Joint Clinic located in St. Catharines, Ontario. And what I'm going to do in this video is review a few of the key tests that we would do in our office to assess the hip. And I'm not only going to show you how we do this here in the clinic, but I'll also show you how you can do these tests yourself at home to get a sense of how healthy and how mobile your hips are, or alternatively, where there may be some issues that need to be addressed. Now keep in mind that the hip is a complicated area. So to assess the hip, we are actually going to need to perform several different tests to get a full and accurate picture of the overall physical health of this region. But for the sake of demonstration and to keep these videos a little bit more focused, I'm going to separate these tests based on the region of the hip and by the muscles that we are trying to evaluate with these tests. So in this video, I will review the key tests we would use to assess the hip capsule and the deep external rotator muscles. Now this is a really critical area as these deep hip muscles function very much like the rotator muscles of the shoulder, which makes them very important for joint stability and control of the hip joint itself. And if there's issues here, they are typically going to affect all aspects of hip function, which means if there are problems here, this is often a big priority from a treatment perspective. And just to provide a sense of the anatomy we're talking about here, if we look deep into the hip underneath the big gluteus maximus muscle, we will have the piriformis muscle, which many of us have heard of. But this deep external rotator group also includes the superior and inferior gemelli muscles, as well as the obturator internus and the quadriceps femoris muscle. And then deep to all of these structures, we have the hip capsule, which completely surrounds the hip joint. Now, we often don't think too much about the hip capsule, but if this investing capsule of tissue becomes tight and restricted, it can really compromise the normal movement of the hip. So we really need to be aware of this critical structure during our assessment and during our treatment. And then what I'll do in two accompanying videos, I'll review the tests we would use to assess the posterior lateral hip, which includes the gluteal muscle group, as well as how to assess the anterior hip, which includes the hip flexor muscles. So with that said, let's review how to assess the hip capsule and the deep external rotator muscles. All right, so this test is just a basic test to look at internal and external rotation of the hip. So what you want to do is just being laying completely flat on your back. The leg that we're testing we'll have up close to us. The other leg is just extended resting on the floor. And what we're going to do is we're just going to bring that leg up so the thigh is approximately 90 degrees, or the knee is facing up towards the ceiling. Knee is bent 90 degrees. And from here, all I'm going to do is slowly rotate that leg inward as far as I can. Hold for just a moment, and then we can do the opposite, rotating outwards. Now, as you rotate inwards, this is checking external rotation of the hip. As we go outwards, we're checking internal rotation. And a couple things that we want to look for here is, first off, this should not cause pain. If this is causing any discomfort, especially if it's causing discomfort in the front or the anterior part of the hip, this might be an indication of a problem with the hip joint itself, whether this could be an osteoarthritis or a hip impingement syndrome. So that's something that if there is pain, we're going to have to investigate this a little bit deeper. Now, if it's not painful, we're simply looking to see how far does the hip move into these rotations. So if I'm coming inwards, remember this is external rotation. Under normal circumstances, I should see this rotate about 40 to 45 degrees. And 45 degrees is a range where we can kind of pretty closely visualize this. We want to get this in that ballpark. If it doesn't go 45 degrees and it's tight, that's an indication that there's some restriction, either in the capsule itself or in those deep hip external rotator muscles that we may need to address. Now, if we're going outwards, remember this is hip internal rotation. So typically we're going to see that external rotation is a little bit more, but for internal rotation, we're typically looking for this to be about 30 to 35 degrees. All right, so again, just to eyeball this, we can take a look at, remember that 45-degree angle is a fairly simple one to visualize. So what you want to see is this is close to, but maybe it doesn't have to get exactly all the way out to 45 degrees. All right, and if it isn't, then that's typically going to be an indication, again, that we have some restriction in those rotator cuff muscles, or very commonly, if it doesn't go internally, that's an that would be an indication that that hip capsule may be tight and limited and needs to be addressed. Now, the other thing we want to look at is, in addition to passive range, I want to know, do these muscles work properly? All right, so we can do a very similar movement, but instead of us doing it, we're going to have the patient actively do it. So again, from this initial starting position, I'm just going to let that leg go. So just hold. Now I'm going to have the patient, you rotate as far in as you can, hold for a moment, and then rotate the other direction as far as possible. All right, so again, we want to make sure that there's no discomfort with this. And here the big thing that we're looking for is this range that the patient can do, this active range, is that going to be similar to that passive range? And if it's not, that's an indication that it may not be so much a passive or a flexibility issue, but a muscle issue where the muscles may be a little bit weak, or again, they may have a lack of control or coordination and it can't achieve bringing the hip into those motions. All right, so another test that you can perform, and one that's often a little bit easier for you to do yourself at home, is we can perform this internal-external rotation test from a seated position. Now, in order to get this right and get the most accurate information, there's just a few things you want to keep in mind. First off, you want to be sitting on something tall so your legs can hang freely, and you want as much of your thigh supported as possible. So whatever surface you're sitting on, whether it's a bed or a tall table, you want that to go right up to the back of your knee. Now, the other thing we want to do is we want to make sure we're isolating motion from the hip itself. So to help with that, what we can do is we can place a yoga block in between the knees here. You don't have to squeeze this very hard. It's just to stabilize the thigh so it doesn't abduct and adduct while we're doing this. And now if we're going to test internal rotation, all you're simply going to do is rotate your leg outwards as far as you can. And again, just like with our initial test, we're looking for that to go about 30 to 35 degrees, right? So remember, our 45-degree angle is somewhat easy to visualize. So we just want that to approach or get close to that 45-degree angle. Now we can do the same thing for testing external. Now the only issue with external is when you rotate, you're often banging into this leg here. So you just want to make sure you're getting that out of the way. So you can either extend it and rotate this leg underneath, or we can just flex it a little bit underneath and again, let that leg come up over the other direction. But either way, you want to make sure that this leg isn't interfering with the test. So from here, you're just rotating, trying to get that foot up as high as you can. And you also want to make sure that that leg doesn't lift off the surface that you're on. You need to make sure that thigh stays resting so it's an accurate reflection of what's going on at the hip itself, and we're using the hip muscles to generate that motion as opposed to generating that movement more through the adductors and the internal aspect of the thigh. Now, before I end the video, there's just a few more things that you might find helpful. First, as I mentioned in the video, I have also done 2 accompanying videos that discuss how to assess the anterior hip and the hip flexor group, as well as the posterior lateral hip and the gluteal muscles. And so that might be something helpful to review as well. Now, if you want to learn a little bit more about the causes of non-traumatic hip pain and understand why so many hip conditions just seem to show up out of nowhere for no obvious reason, you can check out my video on the common causes of non-traumatic hip pain. And finally, if you want to learn a little bit more about how I actually go about treating these non-traumatic hip conditions, I have a video that covers that as well. All of those videos are available on the hip pain section of my website, and I will also include links to all of those videos in the description below for this video.